All right, I believe we're live right now. So everybody, welcome back to another PCBH Corner. I'm David.
I'm Bridget.
Bridget, and we got a good crew today. I'm very grateful that we have Jeff Reiter and Patti Robinson joining us today on another PCBH Corner. We have some discussion points that we want to talk about, but really, and just about for the past 10 to 15 minutes, we've been talking. We probably shouldn't have been recording that entire time, just because I think there will be some, this conversation will just evolve on its own. So the one thing, and Patti, we're going to come to you first. There's been some discussion on the CFHA listserv recently about the term consultant and kind of the role of that, the functionality of it. And we're just curious, where did that term come from? And what was the prompting thing about saying behavioral health consultant rather than a therapist, a counselor? What really drove you all to incorporate the BHC or the behavioral health consultant?
Well, I think it was primarily to describe the services in a way that were accurate relative to primary care behavioral health. So the services were intended to be focused on the problem of concern, what was most important to the patient at that point in time, and the role of the behavioral health provider working in this new kind of way was to provide expertise about behavioral science and how behavioral science could inform care to that patient, to the whole team. So a consultant to the team about a specific area of science.
So basically bringing to the team a specific skill set where if a BHC were to go in and meet with a patient, they'd be able to come out with a different lens and maybe operate from or be able to describe what was going on in a slightly different way, as well as providing the patient, I'm assuming, with a different way of looking at things or trying something new versus say, hey, trying only medication options or, just kind of get a different lens on the problem.
Yeah. So primary care providers use consultants all the time, and what consultants do is they make recommendations based on the evidence of their expertise. And then it's the primary care provider and team that implement this over time. So I think Jeff would agree, we're there to help primary care. And this consultant role is real important in terms of kind of furthering the information that the team has available, not just to the one patient we're consulting on, but to other patients that they will see.
And